Thank you for being here at Yale New Haven Hospital for our press conference this afternoon. My name is Mark D'Antonio. I'm the Media Relations Coordinator. Two items of housekeeping. First, after the press conference, we're happy to set up any one-on-one interviews for you with any of our speakers. And number two, we're also happy to provide you with any tours you might like of our Capacity Coordination Center or our call center. At this time, it's my pleasure to introduce the President and CEO at Yale New Haven Health, Marna Borgstrom.
Thanks. Come on over, Rick.
So good afternoon. As Mark said, I'm Marna Borgstrom. And what we wanted to do was just to give you a little bit of updated information and be able to have a dialogue. It's clear that over the last several weeks, we've seen a significant increase in the spread of the coronavirus across the United States and throughout the world. While neighboring states, particularly New York and Rhode Island, have been hit hard, we have felt the impact here in Connecticut, although the cases have been limited. As of today, my best information is the number of positive cases have grown to 5. Across our health system, we've dealt with 3 separate situations, and I think you're aware of all of them last week. A physician who had rounded on patients at Bridgeport Hospital was diagnosed with the virus. On Tuesday, we learned of a patient who was treated at Bridgeport Hospital, also tested positively. And most recently, we had a patient in the Greenwich Hospital emergency room who was confirmed to have COVID-19. 2 of the 3 individuals are New York State residents, and 1 had recently traveled out of state. The 2 patients who were at Bridgeport and Greenwich, fortunately, have both been discharged to their homes for ongoing surveillance. While we're fortunate right now that none of these incidents has led to a widespread exposure, they speak to the community spread of this virus and the need for exceptional efforts to stem the tide so that we don't find ourselves in a far worse situation. As we've said repeatedly, our top priority remains the safety of our employees, our medical staff, our patients, and our visitors. This includes making sure that all of our employees and medical staff across the health system know how to support our patients and how to protect themselves so that they can continue to support our patients. We're working in tandem with the state of Connecticut, with the Centers for Disease Control, across our hospitals and outpatient settings in the Yale New Haven Health System, and very closely with our colleagues at the Yale School of Medicine to respond. I also want to acknowledge Maritza Bond, the Director of Public Health for New Haven, with whom we've also been working in very close collaboration. Throughout our health system, we've been preparing to meet the challenge of a situation of this nature, and the message that we're sending today is that we are keeping our patients and our caregivers safe, and we are ready to care for patients throughout the region should this virus continue to impact Connecticut. We're setting up outposts for specimen collections. We have activated and prepared negative pressure rooms for those who may be seriously ill, and we are working with other institutions across the country and across the globe to share best practices and so that we can learn from their experiences. There's no doubt that these are extraordinary times, and we've launched a number of programs that have been designed to meet the needs of our staff, our patients, and their families, including a call center, 833-ASK-YNHH. We also have a unique capacity coordination center that will allow us to manage patients across our entire health system from Greenwich to Westerly, Rhode Island. In normal times, it allows us to provide the very best care across our system. Today, it's serving as a vital tool to manage information that is and will be critical to our patients' care. For the general public, the Yale New Haven Health Infection Prevention Team has detailed resources on the Yale New Haven website, but we felt it was important to take a minute to outline for the communities we serve the actual steps that we have taken. Today, I'm joined by colleagues from Yale New Haven Health System in the field of prevention, Dr. Stephen Choi, who is the Chief Quality Officer for the Yale New Haven Health Health System and the Yale School of Medicine, and Dr. Rick Martinello, who is the Chief of Infectious Diseases for the Yale New Haven Health System and Yale New Haven and the Yale School of Medicine. I'm also joined by Dr. Tom Balsazak, who's the Chief Medical Officer, actually Chief Clinical Officer now for Yale New Haven Health, and he can also provide an overview of our efforts. But before I ask Dr. Balsazak to make a few comments, it's really an honor to have Mayor Justin Elliker with us today from New Haven, and I'd like to invite the mayor to make a few comments.
Good morning. I wanted to congratulate most of the people in the room for practicing social distancing. I think that after we've reminded the public so many times, wash your hands for 20 seconds, keep 6 feet away from folks as much as you can, don't go to large gatherings, call your healthcare provider before actually going if you're feeling sick. The number of times we reminded people, I think finally it's starting to sink in just how important it is for us to work as a community, and every one of us has a role in making sure that we prevent the spread of coronavirus. On the city side, as many people know, we announced the closure of our public schools, which started today. We also closed our libraries and our senior centers. There's a lot of ramifications to that we're working through, and that's everything from ensuring that families that have children that are reliant on free and reduced breakfast and lunch have access to food, to ensuring that we can advocate at the federal level and the state level for some economic support for families that may have to not go to work for some time because of childcare issues or because they're sick. Our seniors also are relying on food, and that's another area that we're working on. I suspect that later today we will have announcement of further restrictions on public gatherings. We're concerned about some things like this upcoming weekend and St. Patrick's Day and some bars continuing to hold events where there may be a lot of people. We want to prevent that from happening as much as possible, and we want to ensure that the public understands that we all play a role in either spreading or not spreading this disease, and so we're encouraging people, please do not go to large gatherings. I wanted to take a moment to underscore just how grateful I am. In times of crisis, you realize the sacrifice that many people that are on the front lines give in order for the betterments of the whole community. And on the city side, that's our firefighters, that's our folks that are working with the homeless community, that's our police officers, that's our school nurses, that's so many more staff members that are now and will increasingly potentially be putting themselves at risk. We need to make sure that our side is safe so that we can make sure that the public is safe. And I wanted to express my admiration for the staff at the hospital. I think it's not surprising that we've seen that some of the cases that we've had in Connecticut are people that are on the front lines who knew that they were putting themselves at risk, and the hospital is doing everything they can, I'm sure, to reduce that risk to their employees, but still come to work every day because of the importance of their job. What I think is important for us to share is that by learning from the experiences of other communities that are suffering deeply, particularly Italy, South Korea, China, Iran, and some other places in the United States, is if we are proactive about this, we are lucky in that we've had some time to prepare. Even though this is happening very quickly, we've had some time to prepare. We're, as a community, being very proactive. We have a plan for communicating with each other on an ongoing basis. The city's opened its Emergency Operations Center, and we'll have a representative from the hospital staffing so that we can increase that ongoing communication with the hospital. But I'm so grateful for the work that you are all doing. I feel very fortunate that we have expertise that is world-renowned here to help support our residents and the greater New Haven region as we face this crisis. So thank you so much, and I'll pass it back to Marna.
Thanks so much. We're really delighted to have you here. And before we open it up for questions, I'd just like to invite Dr. Tom Balsazak, our Chief Clinical Officer, to make a few comments to contextualize what we're doing in the Yale New Haven Health System.
Good afternoon, everyone, and thank you for coming. Thank you, Marna. I want to underscore a couple of things. First of all, what Mayor Elicker said about the public health response to this disease is incredibly important. We in the medical community, we as hospitals and healthcare providers, we can take care of folks when they are sick. We can't prevent them from getting sick. All of what you're hearing about covering your mouth if you're coughing, washing your hands, social distancing, these are so unbelievably important, because while there is no vaccine for this disease yet, there may come one in the year or so, and during that period of time, this disease will continue to spread throughout our communities. And the only thing that we can do to prevent it are the prevention measures that Mayor Elicker mentioned. The other thing why that's important is because our hospitals and our healthcare providers across the nation are a fixed commodity that we can't scale up that rapidly. And it's important that we slow the spread of this disease, because we know a certain percentage of patients that get sick are going to require our services. And unless we slow or prevent the spread, our resources will be overwhelmed. So we're taking steps to do that here, and all of the other organizations should do so as well. With regard to our efforts around preparing for the coming of patients, we've been watching this spread across the globe for quite some time now. And 7 weeks ago, we stood up our health systems incident command structure so that we would be able to coordinate all of our efforts across our 7 inpatient campuses and all of our outpatient facilities. And we've been regularly communicating with our medical staff and our employees about what we're doing. Some of the things we've been doing is we created a visitor restriction policy that we instituted yesterday. We've done an assessment of what our ICU capacity is, how we might exercise some of our contingency plans to expand that capacity, what if we saw a large influx of patients we would do around elective surgeries, and what kinds of conditions we could delay to increase our capacity. We believe we are well prepared, but we can be overwhelmed if prevention measures don't take hold. Right now, I think we've seen, as Marna said, I think I saw a 6th case in the state of Connecticut. We've treated 2 in our institutions. I'll say happily both of those cases that we were taking care of are home and recovering. So that's very good news for us. I'm also joined by my colleagues, Drs. Martinello and Choi, and many other colleagues here who have been working tirelessly to be ready for this, and now that it is here to treat. And I'm incredibly thankful, as Mayor Elicker mentioned, I'm also incredibly thankful for the talent and the resources that we have, because I think we're well prepared to meet these challenges. So why don't I stop here and see if there are questions, and ask my colleagues here to join me in answering them.
Someone mentioned, is there any, can you provide any of the testing kits yourself here? I mean, can any of that be
Thank you, Chris. So the question is I don't think it got into the microphone, is do we have any ability to test at Yale New Haven Health System? So good question, very timely. Yesterday I received information from our virologist, our head of hospital virology, Dr. Marie Landry, that she successfully was able to use our equipment and was able to test for the disease. She's doing some final steps to verify and validate, and the final approval steps for that. We believe we may be testing as soon as this afternoon, and we're hoping by the middle of next week we will have substantial capacity to do testing here on this premises, in fact, in this building.
That was my next question, I guess. How fast can you scale it up?
Yes.
Some places, South Korea does 10,000 a week. So I don't know.
Sure, I don't think we'll ever get to 10,000 a week. In this building, across the United States, the numbers I looked at just a short while ago is I think there's only been 11,000 tests in the entire United States. And so all of us, all the hospitals, the commercial labs, research labs, and others are working to get testing online. We believe at our hospital here on this one campus, we might be able to scale up to, I'm going to be out on a limb here, and there's a lot of ifs in this statement, I think we'll be able to scale to about 200 tests a day.
Does the hospital plan to establish some kind of ambulatory specimen test center elsewhere in the city?
The health system already has one ambulatory center. It's a facility, an outdoor facility in Greenwich. It's been very successful. It works very well. We believe we are going to replicate that at other facilities within the health system, and we are looking now at sites where we could possibly put one of those facilities in New Haven.
And you mentioned an assessment of the ICU capacity in the health system.
Yes.
What is the capacity here in New Haven, and how many cases are you potentially expecting?
Across the health system, we have an ICU capacity that is around 270, but we believe we can flex that up. That would be under some scenarios that I don't want to think about right now, but we do have substantial capacity that we could flex up from.
And do you have a sense of how many cases you, in theory, are expecting?
That depends a lot on those public health measures we just discussed. The rough numbers, and they're a little bit different depending on where you see. I'm going to actually ask my expert here, Dr. Martinello, to talk about once we know that you are sick, we know what your percentages are for requiring hospitalization, for requiring ICU care, and there is some debate about those, but I think that Dr. Martinello is best suited to speak to those.
Sure. Thank you very much. What we expect is that for the overwhelming majority of people who do get sick with this, that most of them will actually experience a very mild to moderate illness. What the data shows that we've been seeing coming from China and from other countries that have already experienced a great impact from this virus is that about 85% of people are able to just have that mild to moderate illness, with most of them actually being well enough to stay home and to improve upon their health while they're home. For the 15% who experience more severe disease, we expect that they'll be sick enough to be hospitalized. And unfortunately, what we're finding is that about 5% of those among the 100% are sick enough to require intensive care, many of them requiring being on a mechanical ventilator or being on other measures of life support. So we do expect that over the next number of weeks and potentially over the next number of months, we're going to see this infection really spread throughout our community. And as Dr. Balsazek said, the most important things that we can do to try to slow that down are those public health measures, making sure we're washing our hands, distancing ourselves from others, making sure that we're keeping our hands away from our face, because that's one way that respiratory viruses often are acquired by individuals, and then also making sure that we stay home when we're sick and thinking about what we can do within our families and ourselves to try to make sure that we have the capacity that if we get sick or if others get sick in our household, we're going to still be able to manage. We're going to be able to take care of them appropriately, and we're going to be able to support our family and hopefully get to work, because here at our hospital we really need our staff to be well. We need our staff to be here, as we expect quite a few patients to be coming in the not too distant future.
One of the collection centers was mentioned, a closed school in New Haven. Is that still under consideration for collections of swabs and that kind of testing? I don't know if that's...
I would just say that we've been in discussions. The city's been very cooperative, and we will find a location. And, there are a number of properties we're looking at.
Are there any best practices that you all have seen in South Korea and China, elsewhere in the world, where hospitals have been very effective in managing capacity and their response to even more severe outbreak than we've experienced now?
I'll start.
Let me start answering that question, and I'll ask my colleagues to add where I may stumble. There are lots of best practices. In fact, we at the health system have named leads for ICU care, inpatient care, outpatient care, and emergency department flow. These individuals are coordinating the practices that we will be doing in each one of those locations, what medications we will use, what are the ventilator protocols, so forth and so on. And we're standardizing those across our health system. And I'll also say that we are working with the other hospitals and health systems in the state of Connecticut on a weekly basis. We have a weekly discussion where we are sharing all of our best practices together ourselves with the other hospitals in Connecticut. A lot of that information is being based on things that we are reading out of China, out of South Korea, Italy, and other places where they've been unfortunately able to test what works and what doesn't work. And very rapidly, that stuff is making it into the medical literature. We are reading that. This morning, we had a call with a physician that used to work in this institution who now runs a hospital in Wuhan, and we're able to learn firsthand a lot of that information, and we're sharing that freely. Let me stop there and see if there are any things you guys would like to add.
Sure. As with many things in healthcare, our greatest lessons are often learned from tragedies. and failures, but also from successes. And as Dr. Balsasak mentioned, the more standardization of the care processes that we implement across our health system, the better we'll do with this epidemic. We also have colleagues in the metro area, particularly our healthcare colleagues in New York City, who are a few weeks ahead of dealing with this crisis in their ICUs and in our hospitals. So we are on regular calls with them to learn from them what the best practices are, what they're seeing, what they may not be seeing that we heard from the other countries. And then last but not least, one of the most important things, if not the most important thing, is public health measures. We have to practice proper hand hygiene. We have to practice social distancing, and we have to be responsible.
Can I just ask a question about ventilators? I mean, we'll talk about that as an important tool on how many you have and how many you need.
Right now, we have far more than we need, and I mentioned that we have around 270 ICU rooms. We also have more than 270 ventilators, and there's other ways to stretch our capacity beyond that. We have, done this assessment in conjunction with the Department of Public Health across the state of Connecticut. We also have, there is, at the Department of Public Health in the state of Connecticut, they also have some equipment and some things that could extend the hospitals in the state of Connecticut as well. So we think we have enough. It is one of those fixed resources, however, that it's very difficult to get more when we've exhausted our supply, which is why halting and slowing, or slowing and then halting the spread of this disease is so important. Because if the numbers of infections reach the entire population of the state of Connecticut very rapidly, and you apply the percentages that Dr. Martinello just outlined, then you'll notice that we are very quickly outstripping not just the ventilators or ICU rooms, but the entire ability of the hospitals in the state of Connecticut just to admit these patients. So that's the reason why it's so important to slow the spread.
Dr. Balsasak, can you talk about when testing is conducted here?
Yes.
Will you reveal the results, or will that have to be the Department of Public Health? How are those results revealed to patients who are tested?
Yes. So no, the results would be resulted here to our clinicians and physicians, no different than any other test that we do in our laboratory. So the results will be obtained, the specimen will be obtained by our clinicians, it'll be run in our lab, it will be resulted to that clinician back, who will then discuss the results with that patient.
And Dr. Choi, would you mind talking about the COVID-19 call center and what happens inside there, and who it is that you deal with?
Sure. I think we have our banner over to the left here. So we set up a call center to serve the entire community here. And while we expected the bulk of the calls to come from Connecticut, we've had calls from all over the country. And that call center is available to anyone in the community, whether you are a patient or provider connected to the health system, or you are a patient or provider just in the community. So that call center is available. Now it's available 7 days a week. I guess we changed the times. And we're now available 7 a.m. to 7 p.m. And depending on the volume of the calls, we may actually keep that open 24 hours a day. And it's here to serve questions, provide guidance, best practices, and also to communicate with our other partners across the state and the region.
And what protections are in place for staff here at the hospital to make sure that physically and emotionally they're withstanding this outbreak?
Yeah, thank you for the question. I think one of the most important approaches that we take is really working hard to ensure that all of our staff are aware of what's going on. They understand how COVID-19 presents. And as patients come in to our care areas, whether that be our ambulatory office sites or our hospitals, we're asking patients about the illnesses that they may be coming in with. We're actually starting to screen our visitors. And when we identify our patients who are coming in, we take a lot of effort to ensure that they get into a safe place as quickly as possible. We try to get them into an isolated isolation room, and within that isolation room, we're making sure that our staff are wearing the appropriate personal protective equipment. And that includes a respirator, which is just a substantial mask, wearing eye protection to ensure that if there is any coughing or sneezing, that those droplets don't get into their eyes. And then also ensuring that they're wearing gloves and gowns. And these are approaches that we actually take during routine times. For our patients where we're concerned about tuberculosis, these are the same rooms that we use for those patients. When we have patients who come in and have chickenpox, these are the exact same rooms. And if you were to see any of these hospital rooms, you wouldn't be able to really recognize that they're a special isolation room, because really the difference is in the engineering and how the air flows within those rooms. And so a lot of that work is really behind the scenes. And so we expect that our patients will themselves not notice much of a difference, with the exception that staff who are interacting with them will be in that personal protective equipment.
Now,
Yes.
at some point, when you screen a patient, you know, the two parts, like
Yes.
symptoms and then travel, at some point, does the travel question fall off? Like, it doesn't matter if you've been to Italy because you could get it here or in California. Does that change? Does the screening change?
That is changing, and it's changing very quickly. And actually, yesterday within our medical record system, we made some of those changes to reflect how the virus is spreading. We're still asking questions about the countries where we know there's a great deal of coronavirus spreading, but as this epidemic, as this pandemic really evolves, we're going to evolve the questions and how we're approaching patients to make sure that we can identify them as quickly as possible, make sure that we get them into a private room to ensure that they're in that safe area, and then making sure that our staff are using the appropriate personal protective equipment.
Can any of you just discuss, as briefly as possible, how long the virus can live on surfaces, and does it vary from surface to surface, whether it's a human or hard surfaces?
Yeah. So there's some older studies looking at this that suggest that it may live on surfaces perhaps for a few hours, and some of them actually go out to days of time where the coronavirus is stable on these surfaces. There's a lot of work being done right now to better understand with this SARS-CoV-2 coronavirus how it is behaving on surfaces. We don't expect it to be very different than other coronaviruses, and we expect that the routine disinfectants that we use will be is highly effective against this coronavirus, as we see with others. We also expect that the alcohol waterless hand sanitizers that are widely used will also be highly effective, and that the routine disinfectants, including even just soap and water, are going to be highly effective. And so this gets to, I think another one of our public health measures that is so important is, again, hand hygiene, making sure that when you touch surfaces that others may have touched and there may be germs there, making sure that we are performing hand hygiene, but then also making, in the hospital and our other healthcare settings, we're being very cautious to make sure that our housekeeping professionals are cleaning everything just as they normally would, but of course making sure that they're paying extra special attention to those high-touch surfaces to make sure if there are any germs on them that they're cleaned off.
You mentioned that you were in consultation with colleagues all over the world who've been dealing with this, and that there were some things that had been effective in treatment. Can you speak to any of those kind of treatments?
Sure. So we recently, as this morning, got off the phone with colleagues from Wuhan. And so they've been sharing therapies that have been effective, not for all patients, but for the sickest or the most critically ill patients that Dr. Balsasak outlined, those requiring an ICU stay, those requiring mechanical ventilation. So there have been different medications such as antivirals, monoclonal antibodies, other immunosuppressants, and even reconstituted plasma, where they take plasma from patients who recovered and transfused into patients who are not recovering or who are not responding to standard therapies. But we expect the bulk of these patients, when they do come into the hospital, that they will recover with the standard supportive care, such as oxygen, some form of mechanical or airway support, and IV fluids, and just close monitoring.
Okay, well, we're going to thank all of you for coming. We will continue to work to try and keep you updated on what we understand is happening in the state and our progress. Thanks very much for being with us.